Many drinks promise to lower blood sugar with vinegar, cinnamon, herbs, or special blends. Most do not work like medicine, and some secretly contain enough sugar to raise glucose instead. The most reliable choices are usually water, unsweetened tea, or another drink that replaces liquid sugar. The benefit comes mainly from what you stop drinking in your daily routine, not from a miracle ingredient. Some wellness drinks contain juice, concentrate, honey, agave, or enough carbohydrate to raise blood sugar. A product sold for blood sugar support can still deliver concentrated carbohydrate. Its effect depends on the complete recipe, not only the ingredient promoted on the front. A zero sugar version may avoid an added rise, but it does not reliably lower blood sugar that is already high. Avoiding more sugar and treating existing high blood sugar are different. The result also depends on the meal, medication timing, and your response. Start by asking what the drink replaces. Blood sugar rises when your body breaks carbohydrates into glucose. Insulin is the hormone that helps move glucose from the blood into cells. Liquids require little chewing and may leave the stomach faster than solid foods, so their effects can appear quickly. Most drinks also contain little fiber. Fiber usually slows how quickly sugar enters the blood. High sugar, low fiber, and liquid form explain sharp rises from soda, sweet tea, juice, sports drinks, and flavored coffee. This creates two different groups. One group simply removes sugar from the routine. The other claims that a special ingredient actively lowers glucose. Replacement and treatment are not the same thing. Water belongs in the first group. It does not act like a blood sugar lowering medicine. Choosing water instead of soda, sweet coffee, or juice removes a major carbohydrate source from that meal or snack. Lemon water follows the same principle. Lemon does not wash glucose from the bloodstream. It helps only when the flavor makes water easier to choose instead of soda, juice, or sweet tea. Unsweetened green tea is another low carbohydrate replacement. It contains plant compounds called catechins, which researchers have studied for possible blood sugar effects. Results are mixed. Its clearest advantage remains simple. Unsweetened tea contains almost no sugar. Coffee is one important exception among low sugar replacements. Caffeine can raise glucose in some people, even when the coffee contains no sugar. Others notice little change. Sweet creamers, syrups, and large milk portions can raise the total further. For someone who drinks regular soda daily, a zero sugar soda can serve as a temporary replacement. It usually produces a smaller immediate glucose rise. The benefit disappears if both drinks remain in the routine. Milk and plant-based milks show why even the replacement group requires judgment. Unsweetened products may contain carbohydrate, while sweetened versions can contain much more. Protein and other nutrients also differ among products. Many healthy-looking drinks fit neither role. They contain too much carbohydrate to be reliable replacements, yet lack enough evidence to be treatments. A natural label can hide both problems at once. That middle ground leads to the second group, products advertised as active blood sugar remedies. This group includes vinegar tonics, cinnamon drinks, herbal blends, and powders. Judge them by the research, tested dose, and complete recipe. Apple cider vinegar is one of the most common examples. Small studies suggest modest effects before or after meals, but results vary. Those findings do not prove that every vinegar drink lowers blood sugar. Vinegar is acidic, so frequent use can irritate the throat and damage tooth enamel. It may also affect blood sugar. People using insulin or medicines that can cause low blood sugar should discuss regular use with a clinician. The tested amount matters. Homemade recipes rarely use the same measured dose. One person adds a teaspoon, another pours freely, and another buys a sweetened vinegar tonic. Those drinks do not provide the same amount of vinegar. Cinnamon water has the same limitation. Research usually tests measured powders or extracts. A cinnamon stick steeped in water may deliver an unknown amount. Adding honey can turn the drink into a source of rapidly absorbed sugar. Packaged products add two more problems. carbohydrate in the amount consumed, and servings per container. Kombucha shows both. Fermentation may reduce sugar, yet many products still raise glucose. A bottle may contain several servings, so finishing it can deliver far more carbohydrate than one serving suggests. Powdered mixes create the same mismatch. A scoop may contain sugar, starch, caffeine, or concentrated herbs. The scoop used may exceed the listed serving. Read directions for the full prepared drink, not the powder alone. The practical decision comes down to three facts: total carbohydrate, the amount you will drink, and what the drink replaces. A famous ingredient cannot cancel a large carbohydrate load. A low sugar drink adds little value when the original sugary drink remains. Use one label checklist for all packaged drinks. Check serving size, servings per container, total carbohydrate, added sugar, caffeine, alcohol, and listed herbal amounts. Calculate the total for the portion you will consume. Be cautious when a blend does not list individual amounts. Words like natural, detox, glucose support, or metabolism do not prove that a drink lowers blood sugar. The nutrition panel provides more useful information than the largest words on the front. Electrolyte drinks need separate attention because their main purpose is hydration, not blood sugar control. They may help after heavy sweating, vomiting, diarrhea, or prolonged exercise. Some contain considerable sugar. Kidney or heart disease may also change safe sodium or potassium limits. Coconut water also deserves a label check because its carbohydrate and potassium make it different from plain water. With all of those labels checked, compare the drink with the product it may replace. A vinegar tonic replacing soda may reduce the meal's total sugar. The same tonic added beside soda may increase both sugar and calories. If a drink still seems worth testing, compare readings under similar conditions. Use the same meal, portion, medication timing, and test time on different days. Check glucose before eating and again at the same time afterward. One result cannot prove that a drink works. Sleep, stress, activity, illness, meal size, and medication timing can all change glucose. A continuous glucose monitor, a wearable sensor that tracks glucose, can show patterns but cannot prove the cause. Testing should never involve changing medication. People taking insulin or pills that force the pancreas to release more insulin need extra caution. These medicines can increase the risk of low blood sugar. One common beverage creates an additional medication risk: alcohol. It can delay a fall in blood sugar, especially with insulin or those diabetes pills. That effect is not a treatment benefit. It can become hypoglycemia, meaning blood sugar drops too low, sometimes during sleep. Shaking, sweating, confusion, severe weakness, fainting, or inability to swallow may signal dangerous low blood sugar. Discuss repeated abnormal readings with a clinician. Severe symptoms require urgent help, not another home beverage experiment. Outside those warning situations, everyday choices can remain simple. Water, sparkling water, unsweetened tea, and plain coffee are practical defaults. Choose coffee only if caffeine does not noticeably raise glucose or make you feel unwell. No everyday beverage needs to promise a cure. Drinks can support a treatment plan, but they should never replace it. Medication instructions and individual medical restrictions remain part of that plan. The best drink for blood sugar often helps by replacing liquid sugar, not by acting like medicine. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.